Exercise Science 669, Exercise Rehabilitation for the Return to Sports Performance. Assessment 2, Return to Play Testing from Ankle Sprain. Eric Waters. For this module, I've chosen 5 tests to ensure safe passage to return to play following ankle sprain. The first test is a BEST test, or Balance Error Scoring System test. Star Excursion Balance test is the next test. Single leg standing toe rise test is the third test. Double leg counter movement jump test is the fourth test. And then finally, the single leg hop test, the triple hop test. These are to be tested in order from least demanding to most demanding. The first test that will be utilized in our return to play regimen will be the Balance Error Scoring System test. This is a test to assess stability that is static, or static balance. The reason why this has been chosen is it shows good validity, shows good inter-rater reliability in assessing static balance. As we know from numerous studies, static balance is associated with repeated ankle sprains, so it's useful in assessing re-injury risk. The parameters and setup for this test are quite simple. As you can see in the first 5 slides, testing begins on a hard floor, in a double leg position, single leg position, and another contralateral single leg position, and then in standing in tandem, and with both the left and the right foot in the lead. The clinician then asks the subject to stand with hands on hips and eyes closed. For each position, the subject is asked to stand with eyes closed for 20 seconds. Following this sequence on the floor, the subject is then asked to move to an unstable surface, in this case a foam pad. Again, the process is repeated, and the subject is recorded for 20 seconds with eyes closed and hands on hip for each position. In scoring this test, the error types are listed below. The patient would lose 1 point for each error type. If 2 errors are occurring at the same time, only 1 point is added to the score. Hands coming off the iliac crest, opening of the eyes, stepping, stumbling, falling, moving hip into 30 degrees abduction, lifting a forefoot or heel, and remaining out of the test position for greater than 5 seconds, each would gain a point. As you can see in the scorecard, these points are tallied for both the firm surface and the foam surface. And they are also tallied for double leg, single leg, and tandem stances. Utilizing return to play criteria for this test, Linens noted that greater than 3 points in between limb difference can be used for the cutoff measure, and this would be an identification of chronic ankle instability that may need more rehabilitation work. The benefits of this test is it's easy to use and it has good correlation with other balance tests that assess static balance. A drawback of this test is that it does not assess dynamic balance, which is important following ankle sprain. Since dynamic balance is important following ankle sprain rehab and assessment, I've chosen the Star Excursion Balance test. Measuring dynamic balance is important, as we know. Sensorimotor and kinesthetic awareness and function deficits are strongly associated with chronic ankle sprains. This test shows good validity and reliability in measuring dynamic balance. There is strong evidence to show that deficits in the Star Excursion Balance test can be related to future injury. So this test provides us with information that has value in mitigating ankle sprains, future ankle sprains. The setup for this test is quite simple. 4 pieces of 6-foot long tape are placed in a star pattern. The subject stands with the toe lined up with the horizontal tape piece. He is then asked to reach as far as he possibly can in each direction in the diagram, and this is noted by the clinician. Once a complete circuit is completed, he repeats the process 2 more times and then switches limbs, where he will do another 3 full circuits for the opposite leg. Again, the clinician continues to record each excursion. The distance for each reach and each connection is added and divided by 3 to get an average distance for each direction and each limb. Once the average scores are calculated between the right and the left limbs, they are then compared for symmetry. An increase in asymmetry between limbs, particularly in the anterior direction, indicates an increased risk of re-injury and provides the highest predictive probability for re-injury in both ankle and the knee of this test. One major drawback for this test, particularly in the sport that is being assessed, basketball, this is still somewhat of a ground-based test for being a dynamic test. An advantage of this test is that it's very easy to set up and utilize, and it does have there's strong data to show risk for re-injury in the future. The third test I will be utilizing is a single leg standing toe rise test. It is also a very simple test to use. It shows good reliability and validity in measuring strength and plantar flexion for both the gastroc and soleus muscles. This test can be utilized in assessing for re-injury and performance. It provides information on plantar flexion strength, which is important in avoiding Achilles tendon issues, reactivity, and tendinosis. And in particularly for our example with our mythical patient David, the basketball player, he showed consistent, dramatic deficits in plantar flexion strength, so it does give some useful information on performance measures such as vertical leap. The setup for this test is also quite simple. A box is placed along the wall. The subject stands on the box with the heel off the end of the box. He is then asked to make a complete plantar flexion toe raise to the end range of plantar flexion. Hands are not allowed for use in moving upward. They can be placed along the wall using one finger for balance. The subject is then asked to repeatedly complete the toe raise into end range plantar flexion until fatigue prevents full range of motion. At this point, the subject switches limbs. In scoring, after each limb is assessed, the total number of reps is counted for each limb. For cutoff values, Lunsford and Perry noted some normative data at 25 reps per limb. Others have noted reps closer to 30 for each limb in younger trained athletes. A drawback of this assessment is it is not that useful of a measure for raw strength or force output. Again, this assessment is quite easy. It is also the same assessment that was utilized in David's assessment for return to play and throughout his rehab. It also provides a reliable measure of neuromuscular endurance. The next assessment we will look at for return to play criteria following this injury is a double leg counter movement jump. The counter movement jump can give us very reliable data for several performance measures as well as symmetry and asymmetry measures related to chronic injury. The setup for this test is quite simple as well. Provided one has this technology, the subject is asked to step onto the split in-ground force plates. He is then asked to place both hands on his hips and utilize a complete eccentric counter movement into a concentric vertical displacement, land again, and repeat this 2 more times. The counter movement jump assessment is multifactorial. There are several variables that can be evaluated. For our purposes, we should view two variables for re-injury risk: eccentric and concentric takeoff mean peak force values. Asymmetry in these measures has been shown to be associated with increased risk of lower limb injury. Any asymmetry greater than 7% was associated with increased risk of injury. Therefore, anything less than 7% is desired for a return to play. In this slide, you can see examples of graphing for these asymmetries: the eccentric mean force, takeoff peak force asymmetry, and the concentric mean force asymmetries. There is a very important performance aspect to the counter movement jump as well. We can ascertain limb-to-limb peak force values. We can extrapolate strength measures. And we can evaluate vertical leap height, among many other variables. One of the main advantages to this test is it provides a multitude of factors that can be utilized in return to play evaluation. Some drawbacks to this type of assessment is the equipment is quite expensive. It's not easily understood by the athlete. It's often effort-based, and there are many complicated variables that are assessed and can be generated. However, there are now phone applications that are quite reliable and valid that may be utilized. The last test is another simple test, but it's the most demanding and dynamic. This single leg hop test, and in this case the triple hop, shows good validity in extrapolating strength and power measures and shows good correlation with those measures from other tests that are measuring the same variables. Again, this is another dual purpose test that can evaluate performance and injury risk. Sustained deficits in limb-to-limb total distance variables have been shown following lower limb injury. Regarding performance, strength and power measures can be assessed, and some normative value measures have been produced for male college basketball players. A distance of 632 centimeters was noted as a cutoff for total hop distance by Myers in 2014. Therefore, this may be used by us as a cutoff variable for return to sport. Interestingly, asymmetry in total average hop distance was not shown to affect change of direction test times. This test setup and execution are simple. One piece of tape is placed on the floor. Once the subject has his toe on the line, has his hands placed on his hips, he is asked to make 3 repeat no-stop hops for horizontal distance with a stop landing at the end. This sequence is repeated 3 times for each limb, with the clinician measuring each distance with a piece of tape where the heel meets the ground. The scoring of this test is also relatively simple. The average total distance of each of the 3 hops on each leg is calculated for a between limb comparison. An asymmetry in distance greater than 10% would indicate a failed test and a need for more focused lower limb strength and power. As a final subjective assessment component on the final landing of each limb, the stability can be assessed and evaluated. An advantage of this test is, again, it's a simple test, and it's a good indicator for performance as well as re-injury risk assessments. A drawback of this test is that its subject is dependent on effort. In light of its demanding nature, any lingering pain or injury might be exacerbated. In conclusion, this return to sport test battery assesses balance, dynamic stability, strength, and power, all major components for a safe and effective return to basketball.